Legacy Hospice. Compassion at the end of life. Our standard of care for our patients must always be at the level we would give to our own family. Visit us today at legacyhospicecares.com.
Hello, and welcome to the second of a three-part educational series presented by Legacy Hospice to provide information to facilities, families, and patients regarding our complementary therapy program, the symptoms that we focus on, and how we treat these symptoms in the hospice population. My name is Lynne Hiatt. I'm the Director of Complementary Therapies at Legacy Hospice. I'm also a hospice and holistic nurse, hold a board certification in psychiatric and mental health nursing, and hold certifications in several holistic modalities. Today, I'm going to be discussing anxiety, both anxiety in general and anxiety in the population, our hospice population, and how it presents in those patients. So why talk about anxiety? The American Psychiatric Association states that anxiety is a very, very common ailment and occurs in at least 30% of all individuals at some point in their life. What is anxiety? Again, the American Psychiatric Association defines anxiety as a normal reaction to stress. It may be beneficial in certain situations. Anxiety may be beneficial because it can alert us to changes in our environment, help us to pay attention, and prepares us for some actual threat. The type of anxiety that we are concerned about, however, is the excessive ongoing anxiety, which may not be related to a specific situation. This may be due to excessive worries or fears, and if not treated effectively, may lead to a number of physical and psychological symptoms. There are many types of anxiety disorders. However, many are very similar in presentation and involve a number of factors. Many people with anxiety experience significant fear, with cause either real or imagined. Fear is an emotional response to what is perceived as an immediate threat and may cause an individual to enter into the fight or flight response. The fight or flight response is an automatic physiologic reaction to an event which is perceived as either being stressful or frightening. The perception of threat then stimulates the sympathetic nervous system into an acute stress response and progresses to the fight or flight response. The sympathetic nervous system then triggers the adrenal glands, releasing adrenaline and noradrenaline, which then increase heart rate, respiratory rate, and blood pressure. If you are under chronic stress, as many of our hospice patients may be, your body may be in a perpetual state of fight or flight, which then has very negative effects on your body. A secondary psychological reaction to fight or flight is causing an individual to misinterpret what's actually happening to them. So your body is reacting in a way where your heart rate's fast, your blood pressure's up, you're breathing fast. Some people might actually have chest pain, and what is their thought? I'm having a heart attack or I'm dying, which then again increases their level of anxiety. Again, there are many causes of anxiety, but the causes that we see most commonly in the hospice or elderly population are some of these, which include thoughts of suffering or dying alone, physical pain, other physical symptoms such as shortness of breath or nausea, losses. Pretty much all of our patients have suffered a number of losses. They've almost all lost their homes. They're living in an assisted living or they're living in a skilled nursing facility. Most of them have lost a spouse. They have lost their health. That's why they're unable to live in their normal situation. All of them pretty much have lost their independence and sense of autonomy or ability to make decisions for themselves. Many of them have financial concerns and are very concerned about the current level of isolation that we're now experiencing for them now. Another cause of anxiety is verbalized by some people as being very fearful of burial or being placed in a coffin. Presentation of anxiety is variable. However, I think the one that we see the most commonly in all of our situations is behavioral. We might see patients who are very hypervigilant, the patients that we see who are constantly looking around their environment, checking to make sure that they're safe. What's going on with the other person? Are they going to do something to me? This is very common. Another thing that we'll see is irritability, or in some patients, agitation. We'll also see symptoms of restlessness or isolation. Patients might want to isolate in their rooms, which are now basically their home, because that's their safe place. That's where they feel they have some level of control. Another thing that we might see are cognitive presentations. People, when they're anxious, are usually more confused, less able to concentrate. Sometimes they have racing thoughts. Whole body symptoms. Again, if you're in a constant state of fight or flight, your body just wears out. So many of them have generalized fatigue. They might have increased pain. Some of our patients also have profuse sweating. Some other things that are more common to our population are, again, excessive fears, insomnia or difficulty sleeping. If you're anxious all the time, sleep is frequently difficult. Rapid pulse, rapid breathing, and GI symptoms such as nausea, poor appetite, or even diarrhea. There are also certain medical conditions which have been linked specifically with anxiety, and these include heart disease, diabetes, thyroid disorders, lung disease, specifically chronic obstructive pulmonary disease, chronic pain, certain kinds of tumors, irritable bowel syndrome, and trauma, whether it's physical or psychological trauma. To the elderly population, trauma is different than the rest of us because anything can be traumatizing. So say you fell out of bed and you have to be taken to the hospital to be checked out. That is significantly traumatizing. They're in a situation where they're put in an ambulance by people they don't know. They're taken to a hospital. Things are done to them that they don't understand. So even things which for us would not be traumatizing can be traumatizing to the elderly population. There are some other issues that can create anxiety, one of which is issues within the family. This is something that we see from time to time where there's disharmony within the family, sometimes disharmony amongst siblings, trying to decide what is best for their loved one. Do we want to use certain medications or not? Do we want hospice or not? Patients can feel the disharmony that's going on, and that creates anxiety as well. Again, financial concerns. And also some patients come to us with mental health conditions that they've had ongoing through their life. These tend to put them at higher risk for anxiety also. So what are the complications of persistent anxiety? One of the most common ones is depression. We see that with our patients. They don't want to get out of bed. They don't want to participate. They don't want to eat. Insomnia again, or inability or difficulty sleeping. Chronic pain. When you're anxious, you're rigid, your muscles are tense, which increases pain. Digestive issues. Social isolation is another complication. And poor quality of life. Someone who's anxious and concerned and worried all the time is not experiencing good quality of life. And last, and pretty important, is the fact that some of these patients, when they're very anxious, may actually have suicidal thoughts. We might believe that someone who's debilitated or elderly does not have a risk for suicide. However, that's not actually true. We might have patients say to us, I just wish I was dead, or I want to kill myself, and might think, well, they probably can't do that. But if that should happen, if you should be in a situation where someone says that to you, it's very important to alert the physician, the nurse you're working with, or your whoever's in charge that day, to let them know so that a thorough suicide risk evaluation can be completed. Even people who are debilitated and you would not believe has any ability to harm themselves, if they truly want to do something to harm themselves and have the means, they have the ability to complete this. So this is a very important thing to pursue if you have a patient that's talking about suicide. So how can we help our patients with anxiety? What can we do? It actually starts with us. In today's world, many of us are very anxious. I mean, we're anxious about the COVID pandemic. We're anxious about finances, our jobs. We're anxious about what's happening to our children, our grandchildren, our parents. So we might be anxious ourselves. And when you're anxious yourself, a patient will pick up on your own anxiety. So if you're able to kind of tune into your own state when you walk into work, if you're feeling anxious, do something as simple as taking a few deep breaths. That alone can decrease your own anxiety so you can be present for the way you want to be with your patients. It's also important when you're thinking about the elderly people who may have cognitive impairment and fearful already that we use a very soft voice, we have slower movements, we use direct eye contact, all things that are non-threatening for our patients. It's also important to explain what you're going to do and why you're going to do it. If at all possible, allow your patient to have some say in the choice. So you're walking into your patient's room, they have to get up for breakfast, they need to get dressed, they need to be toileted. But if they don't want to get up and you can tell that they're anxious and kind of struggling to do that, if you can allow them to even have the ability to make the choice to have you go and come back in 15 minutes, that will increase their sense of control and empowerment and therefore decrease their anxiety. Even if you're not completely sure that they're understanding everything you're saying, it's good to be explaining what you're doing, because if nothing else, this will give them a little bit more time to be able to process what you're saying to them. Other things that we can do to decrease anxiety are providing reality orientation to them. So if you go in their room in the morning and the blind is closed, open their blinds. Tell them it's morning, time for breakfast. If you have the time, tell them what the day of the week is. Tell them what the season is. It's summer. It's nice outside. The sun is shining. All things that will help them have a better idea of where they are in the real world. And creating a sense of safety for them is probably the utmost importance in dealing with patients in this age group who are anxious. You might say such a thing as, "You're safe here," or "I'm here to help keep you safe." Anxiety is a very difficult condition to treat in any situation, but especially so in this population, especially because many of them are elderly or very, very ill. Many medications that are traditionally used to treat anxiety are either contraindicated or have to be used in such small dosages that it's very difficult for physicians to get the kind of response that they would like to get to decrease anxiety. This is where holistic therapies or complementary medicine techniques can be very effective. These include such things as acupressure, craniosacral therapy, massage therapy, relaxation breathing, guided imagery, aromatherapy, meditation, music therapy, art therapy, and pet therapy. All of these holistic modalities are things that Legacy Hospice is able to provide to our patients. So this concludes our presentation on anxiety. Our next and final presentation will be a discussion of the holistic modalities that we use for treating anxiety and other disorders, and how they can positively affect our patients with anxiety and other stresses. Thank you again for this opportunity to discuss anxiety. If you should have any questions related to the presentation or any questions related to your specific loved one, feel free to contact our business office at 262-879-8014. Thank you.